Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us today. Today on Community Health Heroes, we'll be speaking with Christine O'Brien, representing the American Lung Association Louisiana, who will talk about Lung Force. Tori Krantz, CEO of the National Kidney Foundation of Louisiana, who will talk about what you can do to help prevent kidney and urinary tract diseases. Mike Rogers, CEO of the Smoking Cessation Trust Management Services, who will talk about the upcoming Great American Smokeout on November 20th. And Danette Murette, owner of NOLA Beans, who will prepare one of their favorite Eat Fit NOLA menu items. So don't go away, we'll be right back with more Community Health Heroes.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer.
Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Each year, loving parents and caregivers cause serious injury and even death to infants by allowing unsafe sleeping conditions. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Don't allow the baby you love to be the next tragic statistic. The only safe place for your baby to sleep is on its back in a crib. For more information, visit cribsforkids.org.
This is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. Pressing dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back to the show. An estimated 200,000 adults in Louisiana currently suffer from asthma, with Louisiana falling within the top 25% of states for asthma-related deaths. Joining us today to talk about what the American Lung Association is doing to help people in our community improve their lung health and prevent lung disease is Christine O'Brien. Welcome to the show, Christine.
Thank you, Dr. Walker.
I wanted to ask you a little bit about what's the mission of the American Lung Association?
Well, the American Lung Association's mission is to save lives by improving lung health and preventing lung disease.
Can you tell me a little bit about what Lung Force is?
Yes, Lung Force is a new initiative by the Lung Association, and it specifically targets women and lung cancer among women. Lung cancer among women is the single deadliest cancer. It actually kills more women each year than breast, cervical, and ovarian cancer combined. So what Lung Force is doing is trying to create the awareness of lung cancer among women the same way that October month is for breast cancer. So the color of Lung Force is turquoise, as you can see from my jacket, and what we're trying to do is use the color turquoise and the month of May to promote Lung Force and lung cancer awareness among women, like I said, during the month of May.
Christine, can you tell me why women aren't aware or they're dying from lung cancer versus men?
Yes, actually there is a decrease in lung cancer among men and a significant increase in lung cancer among women. And we really think that that's attributable to the lack of detection of lung cancer. Lung cancer, if detected earlier, has a higher survival rate, but most lung cancer is not detected until the very later stages of the cancer, and there's a very, very low survival rate at that time. It's among healthcare providers being aware of the necessary testing that's needed, and women going into their providers and requesting the testing and the CT scan for early detection.
So Lung Force is really out there to educate women that they are at risk and they need to get in to see their doctor.
Correct.
That's really important information. And then also, can you tell me if I want to know a little bit more, or my audience wants to know about the American Lung Association, where do they go?
Actually, you can call 1-800-LUNG-USA,
Okay.
or for a local number, 504-828-LUNG. And both numbers can give you information about smoking cessation, about the American Lung Association, about clean air, as well as information on lung cancer for both men and women.
And it's really important because women are being underdiagnosed.
Right, exactly.
Well, thank you for this great information. I'm sure our audience really appreciates it. And thank you for being here.
Thank you. I appreciate you having me.
And we'll be right back with more Community Health Heroes.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
And we're back with more Community Health Heroes. On average, nearly 3,000 new patients are added to the kidney waiting list each month. 12 people die each day waiting for a life-saving kidney transplant, and every 14 minutes someone is added to the kidney transplant list. Joining us today to talk about the National Kidney Foundation Louisiana's Kidney Walk and to tell us what the foundation is doing to keep our community healthy is Tori Krantz, CEO of the National Kidney Foundation Louisiana. Thank you for joining us on the show today, Tori.
Thank you for having me. We look forward to it.
Absolutely, every year. Can you tell me what the National Kidney Foundation is doing right here in our community?
Sure. In Southeast Louisiana, we provide awareness, treatment, and prevention for chronic kidney disease and encourage all types of organ and tissue donation. In Louisiana, there are About 1,700 people on the organ donation list, and about 90% of those are waiting for a kidney. So we try to educate people about preemptive kidney transplantation before they go on dialysis, in addition to educating primary care physicians about chronic kidney disease so they can stop the progression of the disease before their patients go on dialysis.
Why do you think we have so many people on that waiting list?
Because of our high incidence of high blood pressure and diabetes, we lead the nation in those diseases, and those are the two main causes of chronic kidney disease.
Absolutely. Louisiana likes to compete with Mississippi on who can have the worst health rankings, it seems like.
I know, so we try to educate people about healthy lifestyle choices, eliminating salt from their diet, maintaining control of their high blood pressure and diabetes.
So it's really important that the public understand that it's really those two factors, the high blood pressure and the diabetes, that end up leading to the kidney disease.
It is, and that's why kidney disease is sometimes called the silent killer, because you don't know how those affect your kidneys, how those diseases affect your kidneys.
And then I understand you had a recent event in our community.
We are actually having our kidney walk on Sunday, November 2nd at Audubon Park. Registration begins at 8. And the walk itself begins at 9:30. We're going to have the Jesuit Jazz Band lead us around the park, which is a short walk, 1.8 miles, but we expect over 800 to 1,000 people out there.
That's awesome. So it's this Sunday, November
2nd, and people can find out more at www.kidneywalk.org, or they can go to our website, kidneyla.org.
So those are two places that you would go for more information about the Kidney Foundation or for the event?
For both. You can find out more information about the programs and services we offer throughout Louisiana and information about our upcoming events, including the Kidney Walk. And we actually have a golf tournament on November 3rd out at Chateau.
Gosh.
Yeah, this is our kidney weekend, we're calling it.
Your kidney weekend?
Yeah.
What if somebody was interested in donating or being a kidney donor?
They can go to our website. We have all the frequently asked questions about organ donation. Organ donors actually can save the lives up to 9 people if they put a heart on their license and talk to their family about their wishes.
Well, that is just incredible information. I really appreciate you being here today.
Good. Well, we appreciate it and hope to see everybody out at the Kidney Walk on Sunday.
When we return, we'll be speaking with Mike Rogers, CEO of the Smoking Cessation Trust, about the Great American Smokeout coming up on November 20th. So don't go away. We'll be right back with more Community Health Heroes.
Hello, everybody. I want to congratulate the American Cancer Society and everyone who's taking part in this year's Great American Smokeout. Over the years, we've made great progress in reducing the number of Americans who smoke. But today, 46 million Americans are still hooked, and tobacco remains the leading cause of preventable early deaths in this country. The fact is, quitting smoking is hard. Believe me, I know. But we can make it easier, which is why we have resources available through the Department of Health and Human Services at hhs.gov to help more Americans put down cigarettes for good. We also know that the best way to prevent the health problems that come with smoking is to keep young people from starting in the first place. That's why in 2009 I was proud to sign the Family Smoking Prevention and Tobacco Control Act, which gives us new tools to keep cigarettes out of the hands of our kids, including new warning labels that make sure that anyone who buys a pack of cigarettes is aware of the risk. Today, some big tobacco companies are trying to block these labels because they don't want to be honest about the consequences of using their products. Unfortunately, this isn't surprising. We've always known that the fight to stop smoking in this country won't be easy. But it's people like all of you who make me confident that together we can help Americans everywhere live longer, happier, and healthier lives.
Packers. Vikings.
Red State. Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Thank you for tuning in to Community Health Heroes. November 20th is the Great American Smokeout, a day created by the American Cancer Society to encourage everyone to quit smoking. Here today to talk about what you can do to use the Great American Smokeout as your target date to kick your habit and free cessation products and services available through the Smoking Cessation Trust to help you do it is Mike Rogers, CEO of the Smoking Cessation Trust Management Services. Thank you for being on our show again today.
You're welcome. Thanks for having me.
So can you tell me an update on the Louisiana Smoking Cessation Trust?
Yeah, I'd love to.
We currently have grown to about 22,000 Louisiana residents that are in our program. We're growing at a rate of a little over 1,200 new applicants a month.
Oh my gosh,
Working
that's
our
huge.
tails off to get that up to about 2,000 a month. That's our goal. We get it to 2,000 a month, then what the court ordered us to do is to reach out to that 200,000, a little over that, Louisiana residents. We'll actually hit that before we run out of clock, because you remember our
10
program
years?
only goes till middle of 2022, and then we're done. We don't know what done means, but we're done. So 22,000 at this point. We'll finish the year around 25,000 applicants in total. We approve about 96.5% of everybody that applies, so it's a very high percentage. It's easy to get approved. The only thing we could disapprove you for would be you answered that you didn't begin smoking cigarettes prior to September 1st, 1988, or the little check we do of your identity says you don't really live in Louisiana.
So that's a really high acceptance rate.
Yeah.
Yeah.
Makes it easy to get in, easy to sign up, easy to get care, and we pay for it all.
Yeah, so if you have like a loved one, a coworker, a friend that you wanted to help them quit smoking, what's the best ways to go about that?
Well, the easiest thing to do would be to get them to go to our website at smokefreela.org, and there's a little application on there. You just hit the button that says sign up, and it takes 3.5 minutes to sign up, and our judge normally approves the applications on the same day that you enter them. So our turnaround time is really, really fast. We're getting the packet out to our members in about 3.5 days at this point, so that's about as fast as you can do that. Once you sign up, you get the little packet in the mail. It has a 5-step instruction sheet. It says do these things and you will take the greatest advantage of the benefits we give. And the benefits we supply are all the recommended treatment modalities for treating tobacco addiction. So you can get medication, you can get quitline services, you can get a little bit of support from your doctor. That'll leave out the medications.
No, some
you
medications.
can get group counseling.
I was going to ask about counseling, so that's included also.
Yeah, it's all for free. And we have a number of providers around the state that work with us directly, very actively. Other parts of the state where we haven't really done a lot of direct work yet, we have a PPO network out there where doctors can help you. And we have the quitline's always available no matter where you are.
Okay. Is it 24 hours a day then?
It's not quite. We have it set up less than that because we didn't have enough volume for it to create that. We're having a discussion later this week with that vendor that does that for us to see whether they recommend that we extend those hours or not. But it hadn't been a problem so far. People get the care and the support they need, and that coaching. And coaching is all about having somebody there when you need them that can just talk you through it and say, hey, try this, try that.
Right, and even kind of like what to expect.
Fight the urge.
Right, absolutely. And then you have a really big day coming up in November, and we also have our Kick Butts Day in March. Can you tell me about why that's so important?
Well, we look for any kind of celebration, if you will, that could get the attention of the smokers. It's important because we're all really, really busy people. So a couple of times a year, there's some that deserve our attention, and the Great American Smokeout coming up on the 20th of November is one of the biggest. It's also one of the easiest to participate in. Okay, because I was telling you before we went on camera that was originally set up by one of those. I think it's the Cancer Society. I'm not really sure which one it was, but anyway, they set it up as a challenge. It was a one-day challenge to put the cigarettes down and donate the money you would have spent to a charity. And it just took off back in the 70s, and it's been going ever since. So it's an easy opportunity for a smoker to say, I'm not going to quit forever, I'm just going to quit for today, and I'm going to do it for a good reason. Now, a better reason would be quit for your own health, okay? But if you can't do it for your own health for one day, do it for charity for one day. So, we're just sort of trying to revive and remind people about what it was about initially and try to get people that are smokers to participate. It won't hurt you in any way if you put the cigarette down for a day. and you might help somebody in the process.
So if our audience wants to go and find out more information, what's the best place for them to get that information?
They could call us or go to smokefreela.org.
Okay.
The number for us, I'll probably get it wrong, is 504-529-5665. I got it right.
Well, I really appreciate you taking the time out of your busy day and all the events that you're doing to help people quit smoking, and I appreciate you taking the time to be here.
Yeah, well, thank you.
And we'll be right back with more Community Health Heroes.
When you have a hole in your neck, don't face the shower head.
Suction out your dough before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
I have had the worst day.
This is Molly.
I would really love a cigarette right now, you know? But no, I had to go and quit.
She's trying to quit smoking.
It's hard. I just really miss those little breaks, you know?
Molly could call us for information that can double her chances of quitting for good.
Maybe I can't do it. I mean, who needs this? It's awful. It's absolute torture.
Or if she just needs someone to talk to. This is the American Cancer Society. This is who to call for help.
New Orleans is known for its delicious food, but dining at your favorite restaurants doesn't have to mean ditching your otherwise healthy diet. Molly Kimball, a registered dietitian with Ochsner's Elmwood Fitness Center, has collaborated with nearly 50 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items on a restaurant's menu, making it effortless for anyone to eat nutritiously anywhere in our city. Every month, we feature a different local chef as they prepare dishes from their delicious Eat Fit NOLA items on their menu. Joining us today for Eat Fit NOLA cooking segment is Danette Muret, owner of NOLA Beans on Harrison Avenue in Lakeview. Danette, thank you so much for joining us on our show today.
Thanks for having us here. We're very excited to be part of the program and to be here today.
This salad looks absolutely delicious. Can you tell me about it?
Sure. It is our Spanish Fort salad. It's our most popular salad on the menu, and it's also part of the Eat Fit NOLA program, which is great.
So what's in the salad exactly?
There's a fresh corn and black bean pico de gallo, grilled chicken, avocado, and romaine lettuce, and then your choice of dressing.
Tell me about these. They look completely different.
This is a very healthy choice.
Okay.
It is a lemon yogurt dressing with Parmesan cheese. You could also go with the oil and vinegar, or our standard dressing with the menu, which really isn't on the Eat Fit NOLA program, is our avocado ranch, but it's delicious. Personally, when I eat the salad, I don't even eat dressing. It's that good.
Because the pico de gallo can kind of act like a salad
Exactly.
dressing. And then on your menu, about how many items are Eat Fit NOLA?
We have 10 items on the menu, but our menu is easily adaptable to the program, so you can come in and custom order anything you want to make sure that you're eating healthy.
So if you saw something that didn't have the Eat Fit NOLA stamp by it, but you were still interested in it, they would just talk with their waitress and say, what can I do to make it healthy? Okay,
Definitely.
awesome. And I understand you make some really cool iced coffees.
We do, and they're very, very healthy.
So usually people worry about, there's tons of calories with all the creams and the sugars and stuff in regular iced coffees. Why is yours so different?
This is our iced coffee that we cold brew. It's just flavored coffee beans that are cold dripped for 24 to 48 hours, and you just add your choice of milk and sweetener. My favorite is the almond milk, which is really healthy for you. I'm going to make you one. This is our pumpkin spice, which is great for this time of year.
And so there's no calories really in the bean because they're flavored.
Exactly. And because with the almond milk and the sweetener, you're looking at under 90 calories.
And which of the sweeteners do you prefer?
I am a stevia drinker. I think it's the most healthy, and it really sweetens well. So that is my favorite.
And so even in the winter and fall months, you still have people coming in for iced coffee?
You'd be surprised how popular it is. And all of our coffees are really, really healthy. There's so many options to get the flavor and not all the fat, but there's so many alternatives that you can use with using stevia, not sweetening at all, using almond milk, using a low-fat milk. But the iced coffee is popular year-round.
And about how many coffees are on your menu?
We have 10 different flavors for the iced coffee.
Wow, that's a lot.
Yes, and some come in decaf too.
So where would our viewers go to find you?
We are located at 762 Harrison Avenue in Lakeview, right across from St. Dominic's School and Church in the center of Lakeview. So please come see us.
Thank you so much for being here today,
Thank
Danette.
you.
Join us next month for our Eat Fit NOLA cooking segment when we feature another fantastic local restaurant offering nutritious and delicious dining options. And we'll be back with more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Storms come up fast. Take time for storm protection now. Reinforce your roof. Make sure you're adequately insured. Shutter windows and other openings. Elevate your home if you live in a low-lying area. To learn more about how you can protect your family and property from storms, visit getagameplan.org and click on Mitigation Plan. Louisiana, we can do this. This mitigation message brought to you by the Governor's Office of Homeland Security and Emergency Preparedness.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.